Hi everyone, Dr. Timothy Gallagher,
Dr. Michael Marciello.
and we're from Maragal Medical. This week we got some exciting news about our fall prevention program. We're going to extend it for a few more months, so stay tuned for more details. Okay, Dr. Timothy Gallagher here again.
And Dr. Michael Marciello.
And we've got our wonderful senior rehab tech, Ashley Gardner, with us. Ashley's in charge of doing most of the fall prevention screens that we do here in the office, along with our great medical assistant, Kim Susi. And today, Ashley's gonna kind of walk me through the fall prevention screen with about 6 tests. There's an initial screen that we do with a speed walking test that we performed already. So what do we have to do first?
The first one is pretty simple, it's pretty straightforward. You're just balancing on a non-moving surface, first with your eyes open and then your eyes closed.
Okay, I should probably turn around, right?
Yep.
Okay. All right.
And all you need to do is focus on remaining your posture upright and keeping your balance steady.
Seems pretty simple there, Tim, but when we get to the eyes closed, I think that's what we're really assessing to see how a person can judge their balance when they take away their vision, or in the nighttime, or in the dusk, when the eyes close and we don't have that input from our vision, it does affect our balance.
Right. And of course, too, I mean, I'm still young, right? I'm 50 years old, so typically we start to see problems with, losing balance or increased falls risk when you're getting towards the age of 65 or older, correct? Okay. So now I close my eyes.
Yep, and now you can go ahead and close your eyes.
Oh yeah, that's definitely different. I almost feel like a drunken sailor.
Well, we're trying to pick up if there is a sway, if there's some asymmetry in your strength. Some people might lean to one side or the other and not know where their body tends to fall in that center of gravity. And that makes a big difference when your eyes are closed versus when they're open.
Yeah, I'm definitely swaying back and forth.
All right, and that's it. And then we head on to the next one.
Okay.
So the next one, you're going to be balancing on a moving platform. This one, you're going to be in control of the platform. So It's going to be, if you lean to the left, it's going to tilt to the left. If you lean back, it's going to tilt to the back. So your job is just to keep the platform level.
Okay.
Again, we're really trying to look at, we're trying to see how your ability to use your muscles to keep it stable. And some people may be stronger in one area or another, or their center of gravity might be off, and this is where you need to find your center of gravity so you can maintain stability.
Yeah, initially I had that little jolt, but okay, now I'm getting, and I can definitely feel like how my core kind of comes into play for sure.
All right, so now the next one is the same thing. You're going to be trying to keep your balance on a moving platform. However, this time you're not in control. It's just going to be moving in a circular motion and you just need to go with it.
Okay.
This is like having your sea legs.
Yeah, I was just gonna say, this feels like when I close my eyes.
Well, when something's moving beneath your feet and you need to kind of figure out where to adjust to it, this is where, again, if you're on a water surface or like a boat, you would need to have this ability to maintain your balance.
Yep.
All right. So this next one is testing your reactive time. So the machine is going to try and throw you off balance by suddenly moving to the left, right, forward, backwards, and your job is to react to that and try and get back to center.
Okay.
This reminds me when I was walking through New York City streets and someone bumps you unexpectedly. It's just going to knock you over, and how you can adapt to that. So just think of anything where it kind of catch you off guard, a swinging door, and if something bumps you, how can you maintain your balance?
You know, it's interesting because I know this, but I am amazed on how much my core is involved with this, especially just trying to get back without falling. That's cool.
All right, so the next one is limits of stability. This one is about weight shifting, and there's going to be a target on the screen, and it's going to keep moving up, down, left, right. And your job is to chase that target by shifting your weight into your toes, your heels, and your left foot and your right foot.
Okay. Oh, that's tricky.
This sounds like a perception issue, doesn't it? So it has to be visually seeing in front of you. Maybe that longer distance, a walkway that may be inclined or have a slope to it. And you need to be able to bring your center of gravity so you are upright all the time and not losing your balance relative to where your body space is going. Seems subtle, but I'm sure you're working hard at it.
Yeah, definitely. Again, it's kind of combination core and then balance, and then just trying to keep it in the bullseye requires a lot of coordination.
When you hear the
that's
machine beeping
my
like
posture.
that, yeah, that's a reminder to
Not
stand up straight.
got it.
That's a difficulty. We have some of our older folks who have scoliosis or have some, postural issues. So this is where it plays a role when you're older and you may have, different spinal problems and anatomical problems. And remember, there's a fatigue factor here too. So the longer someone is upright, the more difficulty it may be to maintain their position. So if you're standing in a counter or standing in a line for a length of time, this could start getting a little uncomfortable for some folks.
Yeah, definitely.
All right, so the next one, we're going to be using the chair. So you can go ahead and sit down.
Okay.
And I'm just going to make sure your legs are at a 90-degree angle. All right, so now this one's pretty self-explanatory. You're just going to stand up and sit back down 5 times as fast as you can without using your hands to push off.
Okay.
And I'll tell you when to start.
We're gonna have pure strength of your legs here. That's a big difference for people who have balance.
But this is a great way to get an understanding of what my overall risk for fall would be. And certainly, for those older adults that have issues with balance, we can really use this as a tool to say, hey, with something in the orange or in the yellow or in the green range, we need to make sure that, we get particular attention to. Okay, we've been running this fall prevention program since the beginning of January, and we've seen some really interesting results. Of course, the public's been able to come in free of charge, utilize our state-of-the-art robotics system, Hanova. Within 20 minutes, you're gonna get an idea of the level of risk you are for fall, and most importantly, the opportunity to schedule an appointment with you to figure out why you're at risk for fall. So I think over the last 4 months or so, we've been able to point out, a lot of the patients that are at risk fall, but boy, you think about losing your balance, but there's a lot of different causes of being at risk for fall.
There really is, and we expected to see a lot, but we have been seeing a little bit of everything.
Right.
We expected in our practice to see a lot more, arthritic knees, arthritic hips, maybe their back has been a little bit more tipping them forward, but we really have seen a lot of neurologic disorders. People with Parkinson's concerns, people who have maybe some peripheral neuropathy, people who have had, again, just difficulties coping with their position sense, not knowing where their center of gravity is. And really, even recently, I had to pick up something that might be central nervous system, maybe even a brain issue,
Right.
because they just couldn't focus, and maybe their cerebellum had some prior stroke or something that was not missed, that was missed from prior examinations.
Sure. So I think it's really important, if you or a loved one have started to notice that you're a little bit more unsteady on your feet, or you've fallen yourself, you're not going to want to delay. We have this opportunity to bring in free of charge. We'll take you through the fall risk assessment. It only takes 20 minutes, and right then and there, you're going to get a nice printout of the level of risk you are for fall, and then again, you'll have the opportunity to schedule an appointment with Dr. Marciello so he can tease out what's actually causing that. And I think it's most important, particularly for those listeners out there that have parents that are seeing this, and they've started to notice that the parents are declining, and you get the family together, you're talking with your siblings, hey, mom or dad, this is a big concern. If your parent or a loved one, if you fall, that's a big deal. People might not appreciate the extent of the level of injury, but isn't it, one of the most common things we see is what, a hip fracture, right?
Well, there's no question that we really are trying to prevent that injury. So hip fracture is so common. People fall to their side, break their hip, but the problem is it's not just a hip fracture. There's a high risk in the older population to have mortality. Yeah. So we're trying to prevent that nursing home visit. We're preventing the long-term complications and really preventing death.
Right.
So we really need to try to keep people upright or get them the right assisted device. Use a walker or a cane if they need it. But really, that is so important to just prevent the fall from the first part, because you may have such terrible deficits thereafter, or again, maybe risking death.
Yeah, and people think sometimes that we're being dramatic, death from a fall. But really, it's the complication of the hip. Then you're in the hospital. Then you're at more risk for infection. And statistically, it's a big deal. So folks, don't delay. If you or a loved one are noticing problems with your balance, give the office a call. Check out the link below. Best thing about it is we take most insurances. Again, the fall prevention is completely free of charge, and you don't want to delay. Well, that's it for today. I'm Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. Have a great day.